Scene 1. Initial patient assessment. Setting is at patient waiting area, patients sitting with relatives nearby while nurse are taking patient assessment and chief complaint.
Good morning, Mr. Hasif and Mr. Shammy. I'm Navin, staff nurse that will be assisting with you with your checkup today. Could you describe how you've been feeling recently?
Hi, Miss. I've been feeling really tired lately, and I got some pain here, and it's hard for me to eat every time I want because I feel like I want to vomit.
Not only that, but he also been losing some weight. I've noticed that he barely eats anything anymore, so it's constantly.
Thank you for sharing that, Mr. Shammy. Your observation are important, Mr. Hasif. Are you experiencing any other symptoms like yellowing of the skin or changes in your urine?
No, I haven't noticed anything like that.
Could this be something serious? We have been so worried so much lately.
I understand your concern. We will run some tests to get clarity. The medical assistant will take a blood sample shortly and we will keep you informed at every step. Please don't hesitate to ask questions.
Okay.
Scene 2. Blood collection by medical assistant MA and lab analysis by medical lab technician MLT. Setting is at blood collection room and lab diagnosis room.
Hello, Mr. Asif. I'm MA Amira. I'll be taking a blood sample now. It might feel like a small pinch.
A few moments later after taking a blood sample.
Alright, we are done with the procedure. Thank you, Mr. Asif, for the cooperation. Don't worry too much. Everything is going to be alright. This result will give us clue, especially about how your liver is functioning. Once the lab processes the sample, the doctor will explain what it means. Hello, MLT Haziq. This is Dr. Hasif. Blood sample. His symptoms suggest possible liver dysfunction. Could you prioritize this test for liver enzyme levels and bilirubin?
Understood. I'll ensure accuracy and prompt reporting. We'll check for elevated enzymes and other markers of liver health. Cardiac liver function test now.
After the result of the test is out, medical lab technician MLT interpreted the result and immediately update to medical assistants in charge.
ALT and ST levels are high. It might be potential liver cell damage. Bilirubin is also high. This might be the impaired processing by the liver. Hello Mira, the results are ready. There's a marked elevation in liver enzymes and total bilirubin, which strongly suggests liver dysfunction. This requires urgent attention from the physician.
Thanks for prioritizing this, MLT Haziq. I'll collect and deliver the result to Dr. Firdaus right away.
Scene 3. Breaking the bad news. Using the SPIKES protocol. SPIKES protocol's acronyms stand for S is for setting. Choose an appropriate time and place to speak with the patient. Before that, prepare and review what to say and the information to share before the conversation. Then, pick a private location where you won't be interrupted. P is for perception. Check the patient's understanding of the situation. I is for invitation. Ask the patient if they want to receive information. Allow the patient to finish sharing their well-being before starting the conversation. K is for knowledge. Provide medical facts and their implications. E is for emotions, with empathy. Explore the patient's emotions and respond with empathy. Acknowledge and validate the patient's feelings. S is for summary. Establish a strategy for support and summarize the conversation. Be clear that the patient did not misunderstand the nature of disease, situation, or the realistic of disease, with or without treatment options.
Come in.
Good afternoon, doctor.
Please have a seat.
Alright.
Good afternoon, Mr. Hasif and Mr. Shammy. Thank you for coming in today. I am Dr. Firdaus, and today, before we begin, we would like to Mr. Shammy, your brother, to stay for this discussion, or would you prefer to speak alone?
No, I would like him to stay. We both need to know what's going on.
Mr. Hasif, could you share your understanding about your symptoms?
I thought it might be stress or something with my stomach. I haven't been eating well lately.
Yeah, we are not sure, but it seems that to be getting worse. He's been a bit tired and weak lately.
Are you ready for me to share the result and discuss what they mean? And would you like to explain why it happened to you?
Please, doctor, just tell us everything.
Mr. Shammy and Mr. Hasif, please look at this. This is the test we do on your blood, and it shows that your bilirubin level is high and also your liver enzyme is elevated here. It may indicate that your liver is not functioning as normal. We may diagnose this as liver cirrhosis. That is a chronic scarring of the liver.
Cirrhosis? Is that serious? What caused it?
Yes, it is so serious and it may develop when you are having fatty liver disease, hepatitis, and also your alcoholism. But however, we have a treatment for it, like lifestyle changes and medications.
I'm speechless, doc. All of these are so overwhelming. Can my brother, can he recover from this?
I understand that this is a lot to take in, why cirrhosis is reversible, but however, we can still improve your quality of life. We are here to support you through this. I have arranged your meeting with Dr. Firza, that is our liver specialist. She will discuss further on the test and treatments options. Our pharmacist will also explain your medication and how they will help you on this.
Thank you, doctor. I really appreciate your honesty.
Yeah, thank you so much. We follow your advice.
Miss Navin, could you help me send them to Dr. Firza?
Okay, doctor. I will guide you to Dr. Firza office and coordinate the next steps for you.
Staff nurse, pass the report to the liver specialist to review the patient condition and further checkup.
Hello, Dr. Firza.
Hi.
Here are your cases. Patient just now, he has liver cirrhosis.
Okay, thank you, Navin.
Thank you, doctor.
Scene 4, specialist and medication advice. Setting is at specialist's consultations room. Patient and relative are seated, with the liver specialist and pharmacist to know further steps.
Coming.
Good afternoon, doctor.
Hi, good afternoon, Mr. Hasif and Mr. Shammy, the brother. Okay, so my name is Firzana, a hepatologist. So to acknowledge you, with me is pharmacist Alya, and she will be explaining more about the medication and all the regimen after this.
Hi, Mr. Hasif, Mr. Shammy.
Okay, so by that, how are you feeling now, Mr. Hasif?
Mr. Hasif is so worried for the result and further treatment.
Alright, I've reviewed your test result and understand that is difficult time for you. But that I want you to know that you are not alone in this journey. So we are here to help and guide you every step of your way. So by that I will be explain for the normal anatomy and how it causes to your complaint when you come to the hospital this morning. So your diagnosis is a cirrhosis of the liver. That means your liver are having a scar. This is your liver below the lung and nearer with your stomach. So your liver will be having a scar and it's not working as efficient as it should.
Okay, so by that, it will be you will be have a symptoms such as shortness of breathing, and also you will be having abdominal pain. So by that, we can take a step to manage the condition and prevent further damage. So far, are you understand by that?
How serious is it? Will I need a transplant?
It's serious but not hopeless. So at this stage, a liver transplant isn't the only option. We'll be focused on managing the complication, support your liver function, and improving your quality of life.
Can my brother live a normal life with this?
Absolutely. With the right treatment and also the life change, many people with cirrhosis will live with a normal life. So, by that, it's important to avoid alcohol, eat balanced diet, and follow the medication plan. And by that, I will let Alya to explain more on the medication plan. Okay.
So, hi Mr. Hasif. Let me explain the medication that we will be using to help managing your condition. So, one key medication is diuretic, like spironolactone, which help to reduce your fluid buildup in your abdomen and lungs. So, this is. So, next is you will also take lactulose, which prevents toxins from building up in your blood and affecting your brain. So both of these medication are crucial, but they may have side effects like mild dizziness from spironolactone or loose stools from lactulose. So let us know if you feel unwell at any point so we can adjust your treatment. So these medications are part of your a broader plan which includes regular follow-ups and lifestyle changes. You're not alone in this, and we are here to ensure the best possible outcomes. So far, do you understand? It is very important to take this exactly as prescribed. If you notice side effect like severe fatigue or confusion, call us immediately.
Yes, and we also will monitor your condition regularly, and we will having your blood test, imaging, and ensure we are on track. And remember, if you ever feel overwhelmed, you feel free to reach us because support is always available with us. Okay?
So your health and well-being are our top priority, and I'm confident this treatment plan will make a positive difference. You are not alone in this. We are a team.
Thank you. It's a relief to know there's a plan. I am ready to do whatever I need to take to feel better.
Yeah. We together will support him through this. Thank you so much for giving us hope.
Don't worry, you both are doing the right thing for coming to us. We'll take this one step at a time together. Okay? Okay, so is there anything else to ask?
I think no.
Okay, so if there's no questions, so we will meet next appointment after this.
Right.
Okay, sure. Okay, so thank you everyone.